when young people were asking about accountability.
Kenyatta Hospital being one of them, taking the largest portion with 1.58 billion, as I stated clearly at the genesis of this interview.
My name is Oscar Kiplagat, a member of Bunge la Mwananchi.
Okay. Next. My name is Oluoch Babu, member of Bunge la Mwananchi Kopa.
My name is Jawara JM, member of Bunge la Mwananchi, youth leader in Nairobi and a policy expert.
Yes, my name is Owino Gonzaga, member Bunge la Mwananchi.
Yes, I've seen you also, all of you here vying in various positions in your various constituency. Before engaging, as we engage in this national politics, we've seen there's a lot of challenges in health sector. There's a billion cash which got lost. What can you tell us about this 11 billion get lost, Mr. Oscar?
Actually, this news is reaching us at the right time, when young people were asking about accountability. Are you getting it? So actually, as young people, we are happy because we have already identified one snake and we must eat the head. And for your information, we are actually preparing and we will announce as young people, if we agree, all of us, that if 11 billion in Ministry of Health will not be accounted, we will be coming to street. That is clear, because it will be a peaceful protest asking for accountability from our leaders. Yeah.
Yes, Mr. Bob.
Thank you very much, my moderator. First of all, I, as a member of the fourth estate, we are very deeply dishonest and disheartened by this kind of misfortunes and the trajectory that is proceeding and adhering into the health sector. First of all, recently yesterday, we actually experienced a very sudden and incoherent news about the SHA losing 11 billion shillings. In the health sector, we have actually confirmed several cabals and shenanigans that are siphoning the institution and the progression of health sector into a retrogressive exodus. First of all, if you go into Kenyatta Hospital, let us leave the 11 billion Kenyan shilling first. Kenyatta Hospitals is being owed 1.58 billion shillings by SHA. Yet these Kenyatta Hospitals makes 50 to 40 million per day. And this 50 to 40 million per day, Kenyatta Hospital deposited it into the government account by the name e-Citizen. And this e-Citizen makes 100 billion, 1 billion per day, or 7 million in the lower end. So we are asking ourselves, where are this money going? Because Kenyans are doing a lot of efforts towards building our nations and requiring our leaders to hold the public trust. It is in the recommendation number 2 of the NADCO report. The NADCO report was one of the 10-point agenda number 1. That was one of the grievances that the Right Honorable, the late Raila Amolo Odinga, wanted and advocated for its full implementation before it died. And in the NADCO report, the content was inclusivity. This inclusivity we are not being given because the government is always preaching reconnaissance and being biased to the people of Mwananchi rather than holding the public trust. So we want the Cabinet Secretary for the Health, Waziri Eden Duale, you have to come out clearly to the public and tell us, as the taxpayers of this great beloved nation, tell us where the 11 billion Kenyan shillings is, and tell us why Kenyatta Hospital is being owed 1.5 billion Kenyan shillings by SHA. Yet you are contemplating the incoherent issues that SHA is working. Should you fail to come and give us the clear verdict upon that, then our wrath is going to the street and we will actually unearth you in that docket with immediate effect. Thank you very much.
Yes, Mr.
Yes, thank you so much. This is Jawara JM. I'm so dismayed by the matter of losing 11 billion Kenyan shillings in matter health. We understand that health is a devolved function. But we do not understand why the president of this country, Dr. William Samoei Ruto, has been holding or clinging on this particular matter, health, because healthcare is a matter for devolution. If you looked at the fourth schedule of the Constitution of Kenya, you will see they've listed the functions that are supposed to be implemented by the relevant county government. So this matter, health, when we talked about it and we said that it should have been done by the county government, the president challenged Kenyans. And now that 11 billion has been lost, the question we are asking as Kenyans, where is the right accountability? And if there is accountability, where are the members of parliament and the senators who are supposed to provide oversight over the government, this Kenya Kwanza maladministration? I usually talk about as maladministration because it has failed since the day first it came into office. And we are asking as the young people in Kenya, the question goes to the president of Kenya, together with the members, the cabinet, the CS for health, that is Bwana Duale. We are asking question, where is 11 billion Kenyan shillings? And if you are telling us it has been lost, we created a system SHA worth 1.3 billion Kenyan shillings. And you told Kenyans that this particular system, it is very superb. It is supreme. We cannot lose money. It shall be detecting any kind of unscrupulous activity from the medical doctors. But now that we have lost 11 billion Kenyan shillings, what can you tell Kenyans who are paying taxes every year? Kenyans who are being overburdened by taxation. Every other time, Kenyans are overburdened by taxation in the finance bill. Yet we are doing our best to ensure that we can be able to help this country. Another point that we want to talk about is this. When we say healthcare, we were talking about universal health coverage that was started by the former President Uhuru Kenyatta. And when you see that this particular healthcare is having a problem in Kenya, we ask ourselves, what really happened? Where did we go wrong as a country? Because healthcare is supposed to help every other Kenyan. In case you go to a hospital, SHA pays for you everything. It caters for you everything. You do not need to go into a debt in order to cater for your medical health. But now that 11 billion has been lost, and we shall tell that money follow functions, and in case billion has been lost, 11 billion, then how many functions have been lost? How many citizens of Kenya, their medical are in jeopardy because of 11 billion Kenyan shillings? Now I understand, because we are 52 million Kenyans, and not all of us have been covered by SHA. So the moment we have lost 11 billion Kenyan shillings, it means almost 32% of Kenyans are not going to be covered by these monies because they have been lost, taken by someone else. But the Cabinet Secretary for Health has not done the due diligence to ensure that investigation has been done, to ensure if there's people are taking this money, who are these culprits, and they need to be investigated. The reports need to be written to the relevant office of the Directorate of Public Prosecution, to the DCI, and the relevant institution to ensure that this money can be traced where they are. So these are the matters that we need to investigate as a country. But when we see the Cabinet Secretary for Health just sitting and telling Kenyans on national TV that this money have been lost, but there are no investigation, then we wonder, where is the oversight? Where is accountability, which is enshrined in Article 12 of the Constitution? We need to follow the Constitution to the letter. And the President, because he is the leader of the government, he needs also be talking about these issues. And ministers need to be sacked because of such an issue. We cannot be losing money and yet the country is just comfortable. Yet we have lost the money. Thank you so much.
Okay, Mr.
Yes, they say a wealthy nation first must be a healthy one. You cannot be wealthy when you are not healthy. But in this circumstance where we are in a situation where a country that we are proud of, called Kenya, the first headline that we see in a nation is that 11 billion has been looted from the Ministry of Health. And it is coming at a time that just recently we had news that Kenyatta, which is a level 6, a referral facility, patients could not be fed in this facility. There were no reagents to even take the patients to the lab. The question that we beg to get the answer from the state is, if we cannot take care of the basic thing like health, to the extent that the news that we find or the kind of interactions that we make with the people in this country is where people are bleeding either because they have gone to the hospital and they could not be given just the mere simple thing like the food, or rather they were there and they were not taken to the lab, but they were told that treatment took place. How do you treat somebody without taking to the lab to do the diagnosis of that disease, to know what somebody is suffering from? And then the next few days you get that now 11 billion is missing. How much of the quantity of food we can acquire by just a mere by amount of 11 billion? It's a lot of money to even think of. But now look at it this way. We moved from NHIF and we were told that the best cover that Kenyans were really going to enjoy was this one of SHA. Now, SHA came, but what is the information we get from the public? You are told that your surgery is going to cost 240,000, but SHA is telling you we are going to give you 70,000. Even in terms of percentage,
47,000.
yeah, even it's a low percentage. But during the NHIF, we were living in this country where you would be told you are in this facility, but NHIF has covered 75% of your cost of medication. So the family would only look for the 25%. But the new administration told us that there were a lot of fundraising that were really dragging Kenyans in terms of acquiring universal health coverage. So we thought President has seen, or the administration was thinking of a way that even 25% that was burdened to the general public would be taken away from there. But now we are getting a situation where out of 240,000, only 70,000. What percentage is that? Is it that we are worsening it, or we are gaining advancement towards achieving universal health coverage? It is sad, and sometimes we say that you can do some crimes, but others are too heavy to be committed. Like if you touch health, then which kind of population do you want to raise tax? Because if you look at the field of business, we say that insurance is about pulling resources together so that few people will be affected, but the majority that will not be affected, their resources will be put together in one basket and help the few people. Today we are talking of a list of 36 conditions that can be funded by SHA to a tune of a maximum of 500,000. So, for example, the fundraisings that we are getting involved in as a nation is where the bill to go to India for a special treatment is 3 million. And now the SHA, that where the taxpayers' money is being pulled to, is going to cover 500,000. So we are asking, will it be fair to India, or it will be a medical fee? And all of this, when we are still like brainstorming to understand, is it that the system has not been purely understood by the state, then the news of 11 billion missing is coming in. Just recently, we saw structures that are built with the Manyata structures, did surgery that mind-blowing, to the extent that they were claiming 5 million from a grass-thatched facility somewhere in the northeastern, and we are being told surgeries were done there. Now you wonder, surgery procedures, are they done with a razor blade? Is there anything that a patient should be put in a condition that prepares them for a surgery? Or how did that money, or that claim approved? And how did that money really, and who are the government officials? Because if we talk of a national government is not a glass house in Kilimani or Milimani or Apai. Government, if we talk of a ministry representation is even to the grassroots. Then it means heads must roll. We cannot have a nation where we are every day we are being told there is going to be no stone will be left unturned, while it is a bribe, it is a corruption after the other. This is not a question to say that we are in 1 term, 2 term, or no term, or 0 term. This is a situation where everybody must pull up their socks and say this is wrong, because if you are sick, the sickness does not ask you whether you are a 1 term or 2 term The sickness is about something has really interfered with your normal systems of the body, but does not even, if I want a blood transfusion, there is no doctor who will tell me, look for a Kalenjin blood or look for a Luo blood. It is about the blood group, and the blood group does not choose whether you come from 2-term or 1-term. Let us make our institutions work so that we get results and Kenyans' lives are saved, so that we don't have the tourism that is being discouraged even by the ministry. But now we had a situation where somebody who had a problem of tooth, just a dental procedure, we lost that person. The family has not even buried their loved one. Yes. There is no a clear statement that is coming from even the Ministry of Health, Duale himself, to even condemn that. We cannot take the life of Kenyans as a joke, where there is a life that is more important than the other. If you want tax, you want everybody to be alive and healthy to pay the tax. But if they are dead, how much tax do you think that person that had a wrong procedure of dental correction was raising for this country? Are we bothered as a nation that we are losing tax in terms of in areas that are avoidable? I think we have to ask tough questions, but asking tough questions should not be grouped in 1-term or non-term or 0-term. We are a nation, and if you want to be a patriot, you are only a patriot by correcting the mess, mentioning the wrong, and questioning the authority, because they have the mandate of the people. Yes.
Mr. Oscar,
yes, sir.
The rest. Do you think this SHA is working well?
To me, personally, I think young people, we are now realizing that we have a gap between the policy and practice. You see, and that is what thing that this principal secretary and these people should be telling president. But the priority of this, we are losing the priority thing. If you see Minister of Health, is a very delicate docket. Minister of Agriculture, delicate docket, and Interior. The government should concentrate there, unless they don't want us to reach Singapore, the so-called Singapore, the dream of Singapore. That is the dream. We are not saying that Kenya is Singapore, but we have dream of becoming like Singapore. And if these leaders of Kenya Kwanza want Kenyans to reach Singapore, they should tell president that we have a gap between the policy and practice. These people who are drafting these policies, they are corrupt. They are drafting and taking good ideas to president, but behind the curtain, they are the beneficiaries. So we need to tell each other the truth. We need to be honest with ourselves, honest to our country.
I think, Mr. President, or the committee, there's a committee of health. Do you think these committees are working? Because they are not telling us about where these billions have gone. Because the other time the Ndwali told us that he's going to get the committee and talk about it. Also, he talked about there's an added with this question about the selective of the other leaders he was selecting about the ministry, those directors, where we was being accountable that 12 of the directors are from his community. Do you think these people are working honestly?
For county managers.
County managers.
For sure.
County managers.
My take on this, first of all, that committee must be disbanded as the will of Kenyans, will of majority of Kenyans. We must disband, they must disband that committee because they are not delivering. Money is being looted, and these people are there loitering from one community. We are not tribal, but we are telling Duale to stop making Kenya a Somalia state. We will not go that direction as a country.
In terms of when we look at SHA as a policy expert, I can say like this: to understand whether a policy has been effective or not, we need to look through to evaluate. And the evaluation has got some stages we need to do. So on this case of SHA, to know whether SHA is working or not, it is not you going to the hospital then finding SHA has paid for you. It might have paid for you, but not paid for me. We need to look at the number of people it has paid for. And first of all, there are two objectives of SHA. And this objective, they are pegged on the universal health coverage. Number one, it must be able to cover the poor, the vulnerable, and the marginalized in the community. That's the objective number one. Number two, in case you get sick, you get covered, you get treated, then SHA pays. And if it pays if it pays, for example, you've gone to the hospital, the bill has come as 200,000 Kenyan shillings. Then SHA pays for you 20,000. Then you need to pay the rest of the money. That is almost 180,000. Where do you get the 180,000? It means you'll have to sell something. You'll sell your cows, your land, your vehicle. It means it has sent you into a financial distress. And when you are distressed financially, it means SHA has not been able to meet the objective of the universal health coverage. So that is it. So those are the questions you need to ask when looking at whether SHA has worked or not. Not whether you've gone to hospital and it has covered it. And collectively, how many Kenyans that have gone to hospital and they have come out, it has been paid for, number one. Number two, and if it was paid for you, did you go into a financial strain? Did you have to go to borrow some money in order to pay for SHA, to get treated? If yes or no, those are the metrics. So those are the indicators, performance indicators and outcomes we need to look and say this SHA has worked or not. But now, based on the data, SHA is not working effectively because the number of people lamenting, complaining in the country about SHA are so many. You've seen them. And the number of people that is supporting is less compared to the amount of money Kenyans are paying, compared to the amount of money it is deducting from employees' salaries. That is 2.37%. It is quite a lot of money. So let's say, for example, 11 billion has been lost. How many people will this 11 billion cover? So many of them. So if it is lost, it means SHA cannot be effective if this 11 billion has been lost. Yeah.
Thank you. If I second to that, we are living in a very beautiful country with the breastfeeding challenges, but we have the immense potential. The other day, we saw our president himself come in the public when he was addressing the parliamentarian, the PG, before the death of the Right Honorable Raila Amolo Odinga. He came clearly and claimed himself to be a consumer of raw intelligence. Yet, we have several messes that are subjecting this nation into the state of anarchy. But the president is a state of the warm cozy bed, not even coming out to clear or to quantificate these issues, are trying to tell us this and this will be attended on so that we can despite this kind of misfortune from progressing in this nation. This matter of SHA, 11 billion have lost. Kenyan have confirmed it. That is the reality. Yet over 43 hospitals is being owed. There is 13 billion Kenyan shillings by SHA. Kenyatta Hospital being one of them, taking the largest portion with 1.58 billion, as I stated clearly at the genesis of this interview. But in the top vulgarism of the SHA fraternity, we are seeing only one community being given the highest positions. Categorically, to be specific, 5 of the Somali figures are in the top vulgarism in the SHA. So we are asking the government, being led by the President William Ruto in the top executive denominator, that this 10-point agenda, and I will circulate in this 10-point agenda because it is something that is palpable to the people of Kenya. It is supposed to be implemented since it holds the grievances that are affecting the common mwananchi. In the 10-point agenda, we have inclusivity and equality. That is recommendation number 6 in 10-point agenda. There is nowhere it has been categorically cleared that one community is supposed to get several positions in one institution. Then this means corruption will be higher, because this means these figures will be speaking one voice to maraud and lunatic the public resources. We are the taxpayers, and we have the right to question the government, and that is the responsibility of a good patriot, because we cannot expect our country to be siphoned dry by these cabals and the shenanigans in the top vulgaris of this executive. As I told you, the other day you see Kenyatta Hospital in a very dissociating zone, in a looming crisis. Kenyatta Hospital cannot cater for the patient. There is no lab reagents. A patient cannot be diagnosed because there is no any lab reagents. Food shortage. Because you cannot be you cannot went or undergo the diagnosis process if you are hungry. You have to eat fast. And this is the reason why we have to enter into comparison schema. The matrix is this. Look at the government of Uhuru Kenyatta. And I want to use the universal health coverage under the Uhuru Kenyatta, the universal framework, that is the NHIF. And speaking honestly, I told you several days that I am a beneficiary of NHIF. There was a time I was admitted in an hospital, private hospital in Siaya County, that is Sega Mission. I was there in 7 days, that is 1 week. The bill for hospital was 54,000 for 7 days. But I didn't pay anything, even the food that I was eating in that hospital. But NHIF cater for everything for the expenses for that medical coverage.
So which means you are trying to telling us that the SHA is not capable of paying your bill.
SHA is totally incoherent.
Yeah.
That is what I'm trying to say. SHA is totally incoherent. With this thing rebranded in it, in the name of Linda Jami. This is another stupid occasion being branded in this SHA. Because what is Linda Jami have actually impacted in this nation?
But the president told us that if you're already registered in SHA, we'll go to the hospital and be treated and set free.
You cannot be set free.
That is level. They are levels.
They are in several pillars.
Level one, we talk about the community health volunteers. For example, you don't need to go to Kenyatta Hospital when you get sick. First, you go to level 2. When you level 2, these are dispensaries. So when they find this problem is quite big, they refer you to the next level. So when you refer to the next level, then they find they cannot treat you, then you can go to the referral. But you cannot just walk from home, then you go to the level 4. They are preventing the number of people queuing at the hospital. For example, you might go to the Kenyatta Hospital, then they find you, the disease you have might have get treated from a dispensary. You see, you'll be just piling pressure on this particular health. But the problem is this. The problem that I find the whole issue about SHA is this. The president created a system worth 104 billion Kenyan shillings, a lot of money. Then we are losing 11 billion. What was the essence of creating this system worth 104 billion if it cannot be able to prevent theft? So it is beating logic. It's mind-boggling. And number 2, I've seen the issue of county managers for SHA. 13 of them are from one community. And according to some article provision of the Constitution, that is Article 12, to be so precise, and the Employment Act, we talk about the regional balance and ethnic balance. In order to distribute the number of positions, you need to consider the number of communities we have as a country. If we have 42 or 43 communities, we need to distribute the number of this position across equally with equity. So when you give to a particular community, which we know it has got limited number of people, then you give it to them saying they are qualified. It is not a matter of qualification. It is a matter of regional and ethnic balance. So we must be able to balance. So if, for example, this matter is petitioned in the parliament, these people can be able to lose their position because they got it not based on regional and ethnic balance. Because it must be distributed. Masai must be there. Turukana must be there. All people must be there on those positions. 47 of them. And Samburu, Fokomo. But when you see a particular community having 13 positions, it goes against the Constitution, the provision of the law, the statute of the parliamentarian. It goes against everything.
Exactly.
Yeah.
Yes, my.
Yes. Going to the question you asked, is SHA working or not working? I would say that SHA is acting. Yes. To the question whether SHA is working or not, I would say that the working of something is about the effectiveness. It is not, if you want to know that somebody was at work, it's not because he was in the office. It's about the delivery. Was input and output is the measure of performance.
Exactly.
So the questions that we are raising around SHA, is what will make Kenyans know whether it is working, so that that question will answer itself. Is it working? Is it serving you? Because the background of SHA was, let us make it affordable, but everyone is in it. But look at it, the automated system that they use to determine the premium that people pay monthly is even not fair.
And scaring them away.
It's scaring the people that wants to be members of this SHA away. How? Because you are told that now, let us feed your details in the system, and then your premium will be auto-generated. But many people are saying, I just have an M-Pesa shop in the market, which you used to have even during the NHIF, but still you were defaulting 500. But now, because your number is doing business, and the money you are getting, labda you are just a treasurer of a group, this money that is passing through your M-Pesa is already determining your premium. So you are being judged rich, but you are not rich. So your premium is coming to be 3,000, while pesa, you are just a chama, or you are just a treasurer of a chama of a family.
Yeah.
So we are getting people defaulting this, not because they want to default, but because the system is skewed to scare them away, not even to scare them as a country, both young and old alike. We know the problems and the teething issues that are around SHA. When we raise them, if you have a good nini, if your phone book can make you reach an authority, please express the concerns that Kenyans are sharing even in the street. Stop going to a leader and what you can say is, get me 2,000 for data so that I abuse the opponent for you. Go and express what is concerning Kenyans so that we get a solution as a whole. Because when the country is working, both bloggers will be required to subscribe to SHA. But if SHA is not working, the blogging of 2,000 will not be able to take you to the hospital, whether you know how to type or not.
Yeah.
Let us unite and ensure that this things is working.
The government is working.
And the government is working without biasness. Because we are young, we do not have the luxury of going to India. We will be here with that your data and techno. You will be here tweeting in the hospital without SHA to cover your expenses.
Okay.
Yeah, thank you so much. Mine as Jaware JM, I want to tell Mr. President, put your house in order. As the head of government, ensure that the ministers who are not working effectively to ensure that the manifesto of Kenya Kwanza delivered, sack them. Don't fear to sack Duale. Duale, if there is money lost, he needs to be sacked. And to the country at large, we should not be supporting the president when we know some things are going wrong, just for the sake of 2 term or 1 term. Let's be realistic, because health is about our life. Health is everything. For example, sometimes you can go home, you don't have money in the pocket, but you've got good health. You thank the Lord for that. So whenever you are sick, you realize there are many problems, because you cannot do anything. You cannot even impact anything in terms of work. So let us ensure that as a young person, wherever you are, let's continue to criticize where it is due. We should not fear to criticize the government because SHA is not working. Let's call a spade where it is. Thank you so much.
Okay.
As I wind up, thank you very much. And I want to tell the president, come into the perception and come to the public and seek the divergent opinion of the people and see where there is a problem, where there is a state and a bad quagmire. Don't fear to sack Eden Duale. Eden Duale, if have gone into a wrong way, into a wrong direction, and turned to be a glimpse of the unfolding saga, sack the guy and put the people who is there to follow and cater for the dignity of the people and hold the public trust in accountable and transparent manner. This is only the quantification that I can give you to direct this fellow, this pogrom and Amoran, in the name of Eden Duale. Thank you.
Mr. Oscar.
Thank you very much. My last kicker as a youth from Wazingishu County, I want to tell President this, that if President you want to secure your 2nd term, you must start by sacking people, corrupt people in your government, and not only sacking them, but putting them in jail. Somebody like Duale, don't sack Duale. And if you sack Duale, you either take him to Kamiti prison or Somalia. Thank you very much.
Thank you. Now you have spoken.
Thank you, my panelists.
Asante sana.
Thank you, sir.
Ama,
Oh, thank you.
Thank you.
sorry, thank you.
As we finish up, winding up, you've seen their cry about the 11 billion which get lost. So what they're trying to say that the ministry should be accountable. So let's finish it up. Give us your comment, up, down. What do you think the government should do? Thank you.
The talk in town is accountability.
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 Medical report.
That's what they are
Recommendation number 3.